Hello everyone, our topic for today is the bones in thorax. First, let us discuss about what is thorax. Thorax is an area between the neck and the abdomen. It is in between the neck and the abdomen. It contains thoracic cavity and its contents and also the walls of thoracic skeleton. These walls of thoracic skeleton protects thoracic viscera and the abdominal organs. Now let us discuss about the skeleton of the thorax. The skeleton of the thoracic wall is made up of sternum, 12 thoracic vertebrae, the intervertebral discs between the thoracic vertebrae, ribs, and their costal cartilages. And we have sternum, 12 thoracic vertebrae, and the intervertebral discs between the thoracic vertebrae, the ribs, and also their costal cartilages. We have 12 ribs and 10 costal cartilages. Now first let us discuss about ribs. Ribs are curved, flat, lightweight, and resilient. These are the features of the ribs. Each rib contains bone marrow inside which produce RBC. We have three types of ribs based on their attachment to the sternum. They are true ribs, false ribs, and floating ribs. True ribs are also known as vertebrosternal ribs. False ribs are also known as vertebrochondral ribs. Floating ribs are also known as free ribs. True ribs are 1 to 7 in number. Now let us see them in the diagram. This is the first rib, second, third, fourth, fifth, sixth, and seventh. These 7 ribs are known as the true ribs. These ribs are called as true ribs because they directly attach to the sternum. Look at this here. They directly attach to the sternum. So that is why they are called as true ribs. False ribs. False ribs are 8, 9 and 10. Now let us see them in the diagram. These are 8th rib, 9th rib and 10th rib. These 3 ribs are known as the false ribs. They are called as false ribs because they do not directly attach to the sternum. The costal cartilages of these 8th, 9th and 10th ribs, this is the costal cartilage here. The costal cartilage of this 8th, 9th and 10th ribs fuse with the costal cartilage of 7th rib. Through this 7th rib, they attach to the sternum. So these are known as the false ribs and the floating ribs. Now let us see the floating ribs. These are the floating ribs here. They are 11 and 12. They do not attach to the sternum, so they are known as floating ribs. These floating ribs are present in the posterior abdominal wall musculature. Ribs can be further classified into 2 types. They are typical ribs and atypical ribs. Now first let us discuss about the typical ribs. 3 to 9 ribs are called as the typical ribs. They are called as typical ribs because they contain head, neck, the tubercle and the body. If a rib contains all this head, neck, tubercle and the body, then that rib is known as the typical rib. Now let us see them in the diagram. This is the head. This head contains the superior facet and the inferior facet. Let us zoom them. This is the superior facet here and this is the inferior facet. These two facets are separated by the crest of the head. This is the crest here. This is the neck. This neck connects the tubercle and the head. This is the head and this is the body of the rib. The inferior facet of the head articulate with the corresponding vertebrae. That means, for example, let us say we have the rib number 4. This fourth rib has 2 facets, that is superior facet and the inferior facet. This inferior facet articulates with the same vertebrae, that is the 4th vertebrae. But here the superior facet articulates with the vertebrae above it. That means it articulates with the 3rd vertebrae. That is how the superior and inferior facets articulates with the vertebrae. Now let us look at the tubercle. This is the tubercle here. This tubercle has 2 parts, that is smooth articular part and rough non-articular part. That has smooth part and rough part. Smooth part is the articular part and the rough part is non-articular part. Smooth part is articulated with the transverse process. Into the rough part, costotransverse ligament is attached. Now let us discuss about the body. It has the costal angle and also the costal groove. This is the costal angle here and this is the costal groove, costal angle. This costal angle limits the attachment of deep back muscles to the ribs and the costal groove. This is the costal groove here. This costal groove is helpful for the protection of intercostal nerves and vessels. That's all about the typical ribs. Now let us look at the atypical ribs. Atypical ribs are first rib, second rib, 10th rib, 11th rib, and 12th rib. These are atypical ribs. Atypical ribs means if they miss any of the features that a typical rib has, that means head, neck, tubercle, and the body. If they miss any of these features, then they are known as atypical ribs. This is the first rib here. First rib is the broadest rib and also the shortest rib. The body of the first rib contains two grooves. They are groove for subclavian vein and the groove for subclavian artery. Now let us look at them in the diagram. This is the groove for the subclavian vein and this is the groove for the subclavian artery. In between these two grooves, we have scalene tubercle. This is the scalene tubercle here. In between these two grooves, this scalene tubercle is attachment for anterior scalene muscles. And this first rib also has a tubercle. This is the tubercle here. This tubercle is attached to the transverse process of T1. It is attached to the transverse process of T1 vertebrae. And that's all about the first rib. Now let us see the second rib. Now let us look at the second rib. Second rib is longer than the first rib and it also has the tuberosity for serratus anterior muscle. This is the tuberosity for serratus anterior and it also has two facets for articulation with the vertebrae T1 and T2. That's all about the second rib. Now let us see the 10th, 11th and 12th ribs. 10th, 11th and 12th ribs has only one facet on their head and 11th and 12th ribs do not have neck and tubercle. This is the 11th rib and this is the 12th rib. That's all about the atypical ribs. Now let us look at the costal cartilages. Costal cartilages helps ribs to attach anteriorly to the sternum. The blue color here are the costal cartilages. These are the extensions of the ribs which helps ribs to attach to the sternum anteriorly. These costal cartilages also provide elasticity of the thoracic wall. We have 10 costal cartilages. First, 1 to 7 costal cartilages attach directly to the sternum and 8th, 9th, 10th costal cartilages articulate with the costal cartilage superior to it, that is 7th costal cartilage. Now let us look at them in the diagram. This is the first, second, third, fourth, fifth, sixth, seventh. These 7 costal cartilages attach directly to the sternum. And 8th, 9th and 10th, these 3 costal cartilages fuse together and attach to the 7th costal cartilage. With the help of 7th costal cartilage, these 3 ribs attach to the sternum. And that's all about the costal cartilages. Now let us discuss about sternum. Sternum is a flat, elongated bone. It is present in the middle and anteriorly. It helps in protection of mediastinal viscera like example heart. Sternum has 3 parts. They are manubrium, body and the xiphoid process. This is the manubrium, this is the body of the sternum and this is the xiphoid process. Now first let us look at the manubrium. As it is in the trapezoid shape, it is also known as the trapezoid bone and it is the widest and thickest part of the sternum. This manubrium has a jugular notch. This jugular notch is also known as suprasternal notch. This jugular notch or suprasternal notch is present in the superior border. This is the jugular notch here. And laterally, we also have the clavicular notches. This is the clavicular notches here. These are the clavicular notches. To these clavicular notches, clavicle is attached to form the sternoclavicular joint. Inferior to this clavicular notches, we also have a site for attachment of the first rib. Here, the first rib is attached. The first rib is attached to the sternum to form the sternocostal joint. This manubrium is attached to the body of the sternum here. This is the joint here. That joint is known as the manubriosternal joint. This is the joint where manubrium is attached to the body of the sternum. This joint is secondary cartilaginous joint. The most important thing here is the manubrium and sternum lies in the two different planes. Manubrium lies in the different plane above the joint and the body lies in the different plane below the joint. At this joint, there forms an angle that is known as the sternal angle. This sternal angle is also known as angle of Lewis. This angle lies at the level of T4 to T5 vertebrae. At this sternal angle, the second rib is attached to the sternum. The left side of the manubrium is anterior to the arch of aorta, and the right side we have the superior vena cava. Now let us discuss about the body of the sternum. This is the body of the sternum here. This body is thinner than the manubrium. It extends from the vertebrae T5 to T9. The body of the sternum articulates with the costal cartilages of 2 to 7 ribs. Here are the facets for the articulation with the ribs. It articulates with 2 to 7 ribs. Now let us discuss about xiphoid process. This is the xiphoid process here. It is the smallest part. It is the smallest and variable part of the sternum. It lies at the level of T10 thoracic vertebrae. Between the xiphoid process and the body of the sternum, we have between the xiphoid process and the body of the sternum, we have this xiphisternal joint. This is the xiphisternal joint here. This xiphisternal joint is primary cartilaginous joint. Xiphoid process is important because it shows the inferior limit of the thoracic cavity anteriorly. It shows this xiphoid process also forms the intrasternal angle. This intrasternal angle is also known as the costal angle, and it is also the midline marker for the superior limit of the liver, the central tendon of the diaphragm, and the inferior border of the heart. This is the midline marker for the superior limit of the liver and the central tendon of the diaphragm, and also the inferior border of the heart. That's all about the sternum. Let us look at the intercostal spaces. Intercostal spaces. The space that separate the two ribs and the two costal cartilages from one another is known as the intercostal spaces. These are the intercostal spaces here. The space between the two ribs. This is one rib and this is another rib. The space here is known as the intercostal space, and also the space between the two costal cartilages. These are the costal cartilages here, and the space in between them is also known as the intercostal space. There are total 11 in number. These intercostal spaces are named according to the rib that forms their superior border. Let us say the first intercostal space. This is the first intercostal space. This intercostal space is named according to the superior border of the rib above. That means this is the superior border of this first intercostal space. So, as this is the first rib, this intercostal space is known as the first intercostal space. The space below the 12th rib is known as the subcostal space. As we have 11 intercostal spaces, we have 11 intercostal nerves. In between these intercostal spaces, we have intercostal muscles, intercostal membranes, and the intercostal blood vessels and nerves. That's all about the intercostal spaces. Now, let us discuss about the superior and inferior thoracic apertures. This is the superior thoracic aperture and this is the inferior thoracic aperture. Now, let us discuss about superior thoracic aperture first. Superior thoracic aperture is smaller compared to the inferior thoracic aperture. This is for the communication between the neck and the thorax and also the upper limb and thorax. Now, let us look at the boundaries. Posteriorly, we have T1 vertebrae. Laterally, first pair of ribs and costal cartilages. This is the superior thoracic aperture here. This is the T1 vertebrae. This is the first rib which is laterally present. Anteriorly, we have the superior border of manubrium. This is the superior border of manubrium. Through this superior thoracic aperture, the trachea, this is the trachea here, esophagus, this is the esophagus here, and some of the nerves and the blood vessels, these are the arteries and these are the veins that drain the head and neck. Just look at them once again. This is the trachea here and this is the esophagus and these are the arteries and these are the veins. All these structures pass to the superior thoracic aperture. Let us look at the inferior thoracic aperture. This is the inferior thoracic aperture. Now let us look at the boundaries first. Posteriorly, we have T12 vertebrae and posterior laterally 11th and 12th ribs. And anteriorly, we have the costal cartilages of 7th to 10th ribs. And we also have the xiphisternal joint. Now let us look at them in the diagram. This is the T12 vertebrae here posteriorly and this is the 12th rib posterior laterally and anteriorly we have the costal cartilages. These are the costal cartilages here of 7th to 10th ribs. And we also have the xiphisternal joint. This is the xiphisternal joint here. This inferior thoracic aperture is closed by the diaphragm. As we see in the diagram here, this is the diaphragm. This closes the inferior thoracic aperture. This diaphragm separates thorax and abdominal cavities. Structures that pass through the diaphragm from thorax to the abdomen are esophagus, inferior vena cava, and the aorta. All these three structures pass to the abdomen through the diaphragm. And that's all about the inferior thoracic aperture. Now, let us discuss about the thoracic vertebrae. We have two types of thoracic vertebrae. They are typical and atypical. First, let us discuss about the typical vertebrae. The typical vertebrae contains heart-shaped body. This is the body of the vertebrae. And also the circular vertebral foramen. This is the vertebral foramen here, which is circle in shape. And the long spinous process. This is the spinous process here. And also the lamina. This is the lamina here. And also the pedicles. These are the pedicels here. And we also have the superior articular facet and the inferior articular facet. These are the superior articular facets here. And these are the inferior articular facets here. These superior articular facets face posteriorly and these inferior articular facets face anteriorly. And we also have the transverse process. This is the transverse process here. That's all about the parts of a typical vertebrae. The vertebrae contains three sides on each side for articulation with the ribs. There are two demifacets, that is superior demifacet and inferior demifacet. This superior demifacet articulates with the part of the head of its own rib. That means the same rib. The inferior demifacet articulates with the head of the rib below. And we have the oval facet or transverse costal facet. This facet articulates with the tubercle of the rib. That's all about the typical vertebrae. Now let us look at the atypical vertebrae. The T1, the T10, T11, and the T12 are atypical vertebrae. The T1 vertebrae, the head of the first rib, articulates completely with the T1 vertebrae. Superior facet of the head of the first rib does not articulate with the seventh vertebrae of cervical region. It completely articulates with the T1 vertebrae. Similarly, 10th rib also articulates with only the T10 vertebrae, as it lacks the inferior demifacet. 11th rib and 12th rib, the heads of 11th rib and 12th rib articulates with the T11 and T12 vertebrae. These vertebrae lack the costal facets. Now let us see them in the diagram. See, this is the T1 vertebrae here, and this is the T10 vertebrae, and this is the T11 vertebrae. It has the superior costal facet for the head of the rib one, and it has the single complete costal facet for the head of rib 10. And this is the transverse process of T11 vertebrae, which does not have the costal facet on it. That's all about the vertebrae. Thank you for listening.